Hello and welcome to the second asynchronous lecture here for week 10. So this week we've been talking about correctional institutions in Canada. The second asynchronous lecture, we'll be looking at offender classification and it's titled treatment. Really, we're looking at classification and assessment. This overlaps quite a bit with our discussions of the roles of probation officers. It's not a bad thing to go over things again. We'll look at specific examples of assessment approaches and classification in the context of corrections as opposed to supervising someone in the community. But not surprisingly, the concepts themselves will overlap because the same principles apply. This corresponds with the fifth learning outcome we identified in our synchronous lecture. That's identifying and describing the various steps involved in the assessment and classification of inmates. By and large, what we'll be looking at is what's been done historically over the last couple of decades at the federal correctional level. We'll start off first with defining what is meant by classification. So this plays a big role in the role that corrections plays. So for example, once an offender is sentenced, are they a maximum security offender? Are they a medium, a minimum? What kind of treatment programs do they need to be participating in? What kind of safety concerns might they pose to correctional officers and staff within the institution once they're classified? All of this falls under the broad idea or concept of classification. This is where inmates are categorized using a variety of assessment tools to, for example, determine, as I mentioned, the appropriate security level, program placement. One way of thinking about, if we take the example of program placement, is just like there are limited spots available in courses, corrections is like any other public sector institution, always struggling to find resources. So spaces in programs, for example, a violent offender program, it could be a substance abuse program, spaces are going to be limited, which means it's not uncommon for offenders to be on waiting lists to get into some of these programs. It also means that you want to ensure that when spots are filled on those programs, that they're going to those individuals that have the highest levels of need or risk, and not someone who maybe doesn't need the program quite as much as someone else. And this is where the role of classification comes into play. We talked about in last week's class the idea of types of risk factors that are corrections staff, so for example, a correctional psychologist is going to look at to determine level of risk. So they're the static and dynamic risk factors. So as we've talked about in the previous, and you've seen the slide before, static risk factors really are historical risk factors. They are things that cannot change. Why do we look for this information? Well, we know from a large body of research on risk assessment that these are factors that play a role in predicting future criminal and or violent behavior. So one of the most robust findings in risk assessment literature is a prior criminal history, particularly a prior relevant criminal history, predicts criminal behavior in the future. We know that being violent at an early age, so someone who commits a violent act, let's say at the age of 7 or 8 years old, let's say it's an act of animal cruelty, their level of risk for future violent behavior as they get older is much higher than, say, someone who is in their 30s and gets into a scuffle outside of a restaurant or a parking lot. Those are examples of static risk factors. The age at which you are when you first enter a correctional facility, you can't change that. It certainly, we know, will influence your risk. We need to know that to determine risk level, but there's nothing we can do to change it. That's why we also look at dynamic risk factors, because correctional facilities should not just be there for warehousing offenders. So we've talked about the idea in past classes that, number one, most offenders are going to be released at some point. Many offenders who are sentenced are going to serve that sentence in the community. The majority of offenders who are in correctional facilities will get some form of conditional release. There's no such thing as zero risk. The term risk itself implies that there's always some level of risk. So there's no absolute certainty that putting someone on minimum security or giving them day parole, that there's no chance that they're going to reoffend. We want to be able to not only accurately assess someone's level of risk with static risk factors, we want to be able to manage that risk and change it if possible. And that's where dynamic risk factors come in. So again, we talked about this last week when we talked about the roles of probation officers, but these are areas that we know are related to criminal behavior. So your peer associations, your family relationships, active mental health problems, substance use problems, education and employment, they're all correlated with a risk for criminal behavior. They're also things that we can change. So for example, we can, if you have someone that has either a sporadic history of employment or no legitimate history or no history of legitimate employment, and you know that that's clearly been related to their criminal behavior in the past, you can essentially put that person in a job skills training program so that they can develop that particular skill and lower that particular area of risk. So these are the types of or pieces of information that are assessed when inmates first enter the correctional system. Now, federal corrections has what they call an offender intake assessment process. So they use a variety of scales. So one thing that always surprises people when they take more psychology courses, because the image of psychology and popular entertainment focuses a lot on kind of the old school Freudian psychology, the idea of the psychologist sitting behind a patient lying on a couch asking about their parents or their dreams. A lot of what psychologists do, there's a lot of, and if you Google it, you'll see, or if you take a psychology course on personality or abnormal psychology, a lot of psychology is statistics and research methods, and it's developing tools and instruments designed to, it could be assessing personality traits. In Psychology of Crime, CC210, we talk about the psychopathy checklist revised, but developing scales that are based on, and you'll hear the term empirically validated. That is a scale designed to, and in the case of the custody rating scale, determine what is the most appropriate level of security for an offender. Empirically validated means the scale has been developed by looking at what predicts. It could be institutional violations, institutional misconduct. What do we know about inmates' adjustment to prison that correlates with problems within custodial facilities, and how do we reflect that in a scale, or how do we measure that? So it's not based on the custody rating scales, based on a gut feeling. It doesn't allow the person doing an assessment of an inmate as they enter the correctional system to kind of just pick and choose what they're going to look at and what they're not. The items of the custody rating scale have been selected because research shows they're important for that decision, and whoever is using it needs to go through that scale like it's a checklist. So it's a research-based tool that's used to assist in assessing what is the most appropriate level of security for a penitentiary placement of an offender. That's one of the scales that's used in the offender intake process. Another part of it is the more detailed offender intake assessment process, is the Statistical Information on Recidivism Scale Revised. If you take any forensic psychology courses, so for example, I teach PS 350, which is Advanced Topics in Forensic Psychology. Violence risk assessment is a huge area of forensic psychology. There are quite a few different risk assessment measures. Historically, particularly in Ontario, the SIR, the Statistical Information on Recidivism Scale, is one of those scales that is used, the SIR R1. There might be a more updated version. They usually get updated every several years. And it's a risk assessment measure. Now, what makes this one interesting is that it's primarily based on statistic risk factors. Usually in any offender intake process, they use what's called a battery of tests. A battery means it's not just one tool designed to assess someone's risk and the needs that they present with. They'll use several different measures. It's kind of like, you'll notice in a course syllabus, I don't give you one exam with one big question. There's multiple evaluations in any given course to get the best or most accurate picture of just what exactly you've learned in that subject. It's the same thing with offender intake. They use a variety of different measures, the custody rating scale, the SIR, another measure, which we won't talk about in this course, but I would talk about in psychology of crime, is the violence risk appraisal guide, or the VRAG. Like the SIR, it's a violence risk assessment measure. It's also based primarily on static risk factors. One thing that's important to note about that is the SIR really has a very specific focus because it only collects static risk factors. It's more or less used in conjunction with the custody rating scale to determine what level of risk do you present now as we're deciding what level of security to put you at. Because your score on the SIR isn't likely to really change much since it's based on a past history of criminal behavior. It includes such items as, to give you an example, what your current offense was. So there's a scoring system. If I was charged with fraud, I would only get a certain number of points, which would be different than if I was charged with aggravated assault. Your age at admission. Do you have a history of previous incarceration? What's your marital status at your most recent admission? Your employment status at arrest? How the scale works is you get a certain number of points for each of these items. So if you're unemployed at the time of your arrest, that's a negative. It's puts you at a higher risk. So it's scored a particular way. It's kind of an algorithm. This isn't all that different from how, say, life insurance or car insurance works, where if you ever do an interview with a life insurance agent, they're going to ask you a variety of questions. So they're going to ask you if you smoke. They're going to ask what kind of job that you do. So there's a difference between being, a librarian or a university professor, or let's say being, a rodeo clown, where the risk for getting hurt or potentially dying would be higher for that latter example than the former, and that's going to impact your life insurance premium. It's the same thing. If you're younger at the age of admission, we know from Introduction to Criminology that age is correlated with risk for crime. So being younger would increase your risk, but it's an algorithm depending on what the response or the information is with each of these pieces of information. You score it a certain way, you get a total score. There's an index that comes with it based on using this measure, testing it, that would tell you if based on your score, you fall in this category and you present this level of risk. You have a 60 to 70% chance of reoffending. The other part of the offender intake assessment that Correctional Service of Canada has used in the past looks at dynamic risk factors or needs. It's in the past been called the Dynamic Factor Identification Analysis Revised. And essentially what this is designed to do is, if the custody rating scale and SIR are focused more on static risk factors and determining, are you a high, medium, or low level of risk? What's the most appropriate level of security? This tool is more focused on, once we've decided where to classify you, what kind of program needs do you have? That is, in developing your correctional plan, what you should be doing during your time in custody, particularly if you want to get an early release. This is going to identify where you have the greatest set of needs, and we can prioritize your treatment plan. So, for example, the categories of need that corrections looks at: employment and education, marital and family history. So, for example, do you have a history of volatile short-term relationships characterized by, it could be physical or emotional abuse? Did you come from a violent family? Did you go through kind of the foster care system? Who are your associates? Do you have gang affiliations? Do you have any pro-social contacts, people that could help you in reintegrating, or are all your friends involved in crime? Do you have any substance use issues? Community functioning will refer to things like, it might sound silly, but even, do you have any kind of recreational activities in which you participate? Any hobbies? Anything that have you volunteered in the past? What are your connections with your community at large, or are you pretty much isolated? Personal and emotional functioning would look a lot at mental health, personality disorders. Do you have issues with anger or impulse control? The last, attitudes. Do you have attitudes that support criminal behavior? Do you rationalize and justify your behavior, or do you take responsibility? These are all things that through correctional programming and treatment that can be changed, hence why they're dynamic risk factors. All of this information helps in the case management process. And the case manager is the process by which the needs and abilities of offenders are matched with their programs and services. In other words, think of it like sitting down with your guidance counselor in high school and taking some, I used to they did it when I was in high school. We took all these tests and surveys that kind of gave you an idea of what types of careers would be ideal. Now, they probably have obviously changed that, but it's somewhat similar or analogous. The idea is that you use all this information, and there's someone that will work with you in corrections, a case management officer, who will determine that these are the types of programs that you should be really focusing on. This is the information that will help facilitate, that will pass on, that will help facilitate any offender reintegration that occurs if you got conditional release. It all goes towards building your correctional plan. So this is the key component of the case management process. This is kind of the outcome of all this information that's been collected through the custody rating scale, assessing all those needs, the SIR, and any other assessment measures that are included in your file. This is designed to determine what's your best initial institutional placement, what kind of opportunities for work or training in prison, and how are we going to prepare you for release. Part of the assessment process could also be including, so for example, if you have an inmate, someone coming into the correctional system who has in the past owed money to, let's say, the Hells Angels, a biker gang, organized crime. So you know that they call them incompatibles, that you owe money and have had some negative run-ins with this particular organized crime group. We're going to try and put you in a facility where there are either very few of those individuals or, if possible, none, to reduce any chance of you having any run-ins with them. That's all a part of the assessment and classification process as well. That's stuff that hasn't been captured in what we've talked about here. All of this also falls under, and you'll hear about this, we've already talked about it when we talked about probation officers. If you take a course on corrections during your time at the university, you will hear about the RNR model. This was developed by Canadian psychologists Don Andrews and Jim Bonta. It's what the Correctional Service of Canada very much adheres to. It's the risk and need principles, which we'll look at first. We've already talked about these, but the idea that you don't take low-risk offenders and put them in an environment with high-risk offenders. That if you have an offender who is low risk, a minimum security facility is probably the most ideal, that this is going to provide them with the most opportunities to engage in any type of self-improvement for correctional programming, because the types of programming and just the realities of living in a higher security facility like a max security facility are not going to facilitate those opportunities. The need principle is you match the correctional plan to the offender's needs. Someone who does not have a substance use problem doesn't need to be taking substance use programming. Someone who has problems with volatile, I mentioned the example of a history of volatile short-term relationships. That is, for the most part, they're fine. They function quite well. They're not involved in crime or drugs when they're single, but when they're in a relationship, once it starts to go south, which their case history shows happens pretty quickly, that's when frustration kicks in. Maybe they start drinking and their risk levels increase. And that's where they kind of go down the wrong path. There are programs that you could connect that type of offender with. It could be courses around healthy relationships, communication skills. But again, the logic of the need principle is once you've identified the needs of inmates as they enter the correctional process, you find the programs that best address those needs. And you address the high needs first. If there's needs that kind of fall in the middle of the continuum, you would address those if the sentence is longer at a later date. The last one is particularly important. This is something, again, that students should really be able to identify with, the responsivity principles. So as we talked about in our synchronous lecture on alternatives to incarceration and the jobs of probation officers, Not every approach to programming works with every offender. So I mentioned in a previous lecture, Martinson's work in the 70s, where he concluded that correctional treatment doesn't work. So that was the famous conclusion, nothing works. That's not actually true. What Andrew and Bontas have argued, and much research shows, is that rehabilitation programs can be quite effective if you match not only the program to the offender's risk and specific needs, but you deliver the program. That is, how you deliver the content has to match up with it. It's everything from their reading skill levels, how they think. So, for example, the type of psychology you might see in movies and television, that kind of psychodynamic Freudian psychology, which is very much heavily based on the ability of patients to articulate what they're thinking and feeling at a very high level, does not work well in a correctional setting. The other thing about psychodynamic therapy is it tends to be very long-term. It's not short-term therapy. In a correctional setting with conditional release and sentence lengths, you're not going to have inmates for a long period of time. So you need an approach to treatment that can be more effective in a shorter term. But you want to, essentially what the responsivity principle means is it's delivering the program in a way that is going to be most accessible to your target population. So me giving you a book that's intended to be written for people who have PhDs in criminology and expecting you to understand it in the first semester of your first year of university, that doesn't adhere to the responsivity principle, and that's what we're talking about. So again, much of this overlapped, the more general principles around risk factors and assessment techniques overlapped with what we talked about last week on probation officers. That's never a bad thing. It's good to hear things multiple times. But we are done with the second asynchronous lecture, and hopefully that corresponds pretty well with what you're finding in the readings.